Ladies, if you don't think breast cancer can happen to you, you better think again. It can, and early detection is the best medicine. In fact, a mammogram can catch breast cancer in its earliest stages when it's easiest to cure. One Corpus Christi woman can't stress that enough. Virginia Brody has that story.
This month, as Flora Llanes sells cosmetics door to door, she'll also be handing out information about breast cancer. To her, this is much more than her company's public awareness campaign. It's a cause.
I didn't know about the self-examination, that I was supposed to do that once a month. And the mammogram, when you're 40, it's one every other year, and when you're 50, it's once a year.
You see, 6 years ago, Flora was diagnosed with breast cancer.
Like so many of us, Flora took it for granted that she would never get breast cancer, but she did. In fact, it happens to 1 out of every 9 women.
So if you think it just happens every now and then, think again.
I sometimes am shocked about how many people we diagnose with breast cancer.
Dr. Valerie Scott sees a lot more than she'd like to. She says the best way to treat it is to catch it early, long before the tumor is large enough to detect yourself.
Breathe.
The best way to do that is with a mammogram.
In general, when it's that small, the prognosis is wonderful. But really, we need these mammograms and we need these breast exams to find these cancers before they become a real problem.
Flora is just glad she found the cancer when she did. Today, 6 years later, doctors think she's cured.
Well, I feel lucky, yes, that I found it in time, but I think I would have been luckier if I would have found it 3 months before.
That's one more reason to have the test done regularly. The cure rate is much higher. Virginia Brody, Channel 6 News.
Well, fortunately, Flora Llanes isn't the only success story when it comes to women dealing with breast cancer. Early detection seems to be the key to successful treatment. And joining us today on Coping in the 90s is Dr. David Levey. He's here to talk about breast cancer and mammograms. Thank you very much for being with us. First of all, let's go over some of those warning signs that women at home may be easy to detect there.
Yeah.
What are we looking for?
Warning signs generally can be difficult. It can be difficult to tell, but things such as skin retraction over the breast or a frank lump in the area can be a first sign of a disorder in the breast.
And how can you detect from a lump, a cyst, a mole, a common mole?
Starting with a mole, that's usually a skin problem, and if there was a cancerous mole, that would be a dermatologic cancer, not necessarily a breast cancer. The breast is a modified sweat gland unit, and if a mass is seen in the breast, either ultrasound or mammography itself will be best to tell between a cyst and a lump. But mammography, I think, is the standard of care in the community.
Is there a certain age women should start getting mammograms or stop self-examination and start the mammogram?
Well, there's been a lot of talk in the literature about this, and different interest groups are involved. It appears that the American College of Radiology and the American Society of Obstetrics and Gynecology, as well as the American College, that is the American Cancer Society, have felt together that self-breast exams should be done from the 20s on, that the first mammogram should be performed between 30 and 40. After 40, from 40 to 49, perhaps every 1 to 2 years, but after age 50, as age is one of the risk factors for breast cancer, that a yearly mammogram is indicated.
And how about we were talking about mammograms in general, reports a few months ago labeling maybe they're not all that wonderful. What's your answer to that?
I think it depends on the technology. If you're a smaller place that maybe is using a used mammographic unit, or perhaps one that isn't in the best shape, isn't part of the newest technology, you won't get the pictures will not be as good. It's simply a phenomenon related to technology and your technologist. But with the brand new equipment, which is monitored by radiologists and done by accredited technologists, I think that probably this still is the best single test for screening.
What has research shown about breast cancer being hereditary?
Well, essentially this begs the question of risk factors, and I think the single most well-accepted risk factor is a cancer in the other breast or the same breast. Previous breast cancer is the #1 worst risk for occurrence of breast cancer. Age is a factor, but if you have a first-degree relative, either a sister or a mother that has had breast cancer, if your sister or mother has had breast cancer, it doubles, and if your sister and mother have had breast cancer, it's felt that the risk is tripled.
Okay, one more quick question I have to get in here. What if you do detect a mammogram, breast cancer in a mammogram? What's the next step?
essentially you should go back to your primary referring physician, and very soon thereafter a localization of some sort should be done, either breast localization to find the cancer and have it removed with lumpectomy, or at Spawn and Doctors Regional we're performing core biopsies such that the lesion itself, if not palpable, can be biopsied under stereotactic guidance, and we can get a sample of the tissue right there and then in the radiology department.
Sounds great. Easy
All right.
enough. Thank you very much
Sure.
for your information. And if you'd like more information on where to get a mammogram or who can qualify for a reduced cost mammogram, call the local chapter of the American Cancer Society. The number is 857-0134. Coming up, you've probably heard about a haunted house, but we'll take you to a haunted brewery next and find out what you can expect on Channel 6 News at 6.